Hey friends, girl next door OBGYN here. I wanted to pop on and talk a little bit about infertility. It's a topic that I see patients for quite frequently in the office. New patients or yearlies that have already been established with me, or even patients that have maybe delivered with me in the past and now they're trying to get pregnant and it's just taking them longer than they expected. So what I generally will tell patients, this is really bird's eye view here, is that there are kind of 5 reasons why you might suffer or experience infertility. The most common is issues with ovulation. So some women, if your cycles are not very regular, it can be a sign that you're not ovulating every month. There can be lots of different reasons for that. It doesn't necessarily matter. Many of them are treated the same way. But one of the first things I'm going to ask you is your period regular? And are you noticing any signs of ovulation, such as changes in cervical mucus or sometimes a little bit of cramping, mid-cycle spotting? And then the second most common is going to be male factor. So that is where semen analysis become really important. So it actually is really common that men will have a proportion or some component of their semen analysis that'll be a little bit abnormal. The third type is tubal factors. So when we think about the fallopian tubes, are very important so that the egg and the sperm can meet up. And if there's a blockage in one of the tubes, it's going to decrease your chances. So we can evaluate that if you've had a history of infection or you've had a history of endometriosis, then this is going to be more common. And we have a special ultrasound that can help us look at that. For the fourth type, look for either cervical or uterine factors. So there could be polyps or uterine fibroids, things that kind of impinge on the cavity, make it more difficult for implantation to occur. Or the cervix itself, there can be a more hostile kind of pH or environment there that maybe semen have a hard time traversing through. The last and another big category, unfortunately, is just unknown. So once we've ruled out those 4, ovulation, male factor, tubal, and the uterine and cervix, then everybody falls into the unknown or kind of the idiopathic, or we're not really sure category. So when you come to see somebody and you want to start talking about becoming pregnant, they should talk you through all of those components and how we test for each of those. So just wanted to stop on and give you guys a little bit of information about that. Hopefully you find this helpful. If you do, share it with a friend, or comment below if you have more questions. Bye guys.